everybody, this is Dr. Madiha Saeed, board certified integrative holistic family physician, coming to you live from my office here in Naperville, Illinois. Hope you guys have had a phenomenal, awesome, amazing week. Blessed, right? Yay! So, a lot of exciting stuff going on in my life, and I'm sorry I've been away for so long, but my book did hit Amazon bestseller. Yay! And it also number 1 in 4 categories, according to everybody tells me. That doesn't really happen, so yay again! So blessed, and so many things to be thankful for, right? So exciting. So, but let's get back to what we talk about normally on Thursdays. I'm probably going to shift it to Tuesdays. But let's talk about what we usually have talked about, like the factors of inflammation. So let me go ahead and recap of all the things that we have talked about. So for some people who are new or just coming on and or need to just recap anyway, because I know I do. So your chronic symptoms, either it be depression, anxiety, autism, it could be digestive complaints like constipation, diarrhea, IBS, bowel bloating, gas, whatever those symptoms may be, inflammatory bowel disease. We can have migraines or headaches, migraines, sinus issues, allergies, fatigue, irritability, brain fog, weight gain, the list goes on, autoimmunities, cancers, the list goes on and on and on. All of those symptoms have one root cause, and that is inflammation. And there's 2 different types of inflammation. So the first type of inflammation is acute inflammation. That's when you cut yourself and you get a boo-boo for a little bit, and that's actually good inflammation. You want that type of inflammation because of the fact that that actually helps you heal. Yay! So we love acute inflammation. Next one is chronic inflammation. And what chronic inflammation does is that's when you have too much of a good thing. So you have inflammation that constantly, there's an, response from the external environment or internal. It could be infections or stress or the foods that we eat that constantly, the body is constantly on attack. And when it's constantly on attack, what happens is it gets confused and can even start attacking your own tissues, which is then leads to autoimmunity. So that is a state called chronic inflammation. That's like the hidden smoldering fire that lies, within that can eventually destroy the building. So that chronic inflammation is something that regular doctors are not taught to address. We will just band-aid that chronic inflammation with just, with band-aids, right? But never really deal with the underlying root cause. So for example, all of these symptoms are, all the symptoms that you have, but then, from conventional medicine, I'll go and treat each one of these symptoms with a medication. But what I like to do, and in what holistic medicine and functional medicine and all these really looks at the root cause of why that's going on. So if we can decrease the root cause, that will not only help one condition, but then all of them simultaneously. Isn't that crazy? So this is where chronic inflammation, I know these are backwards, but chronic inflammation can lead to all of these conditions. But what is the root cause? And so the root cause, because deficits in any of these, and you've seen them, these are all in my book. They're in black and white, but if you download the Kindle version or the ebook version, that will then go ahead and be color for you guys, so you guys can enjoy those too. And in there it's not backwards like it is here. So we have deficits in any of these can cause inflammation that can cause your chronic symptoms. So we've talked about stress, how 80% of your complaints that come to primary care physicians are due to stress. To make sure you incorporate a regular mind-body technique into your daily routine to help keep damaging hormones at bay. Then we have is your sleep. Optimizing your sleep can really, really help, and to make sure you have a bedtime routine and you are optimizing your day routine for your sleep routine, eating well, stress management, all of that comes into play here. Along with, we have social health. Social health is the friends around you can either drag you down or lift you up. And we want to make sure you only keep those friends around you that will actually, keep you high and above and feel amazing. Because bad friends can actually cause problems. So therefore, this is why I'm a big proponent of love and unconditional and trying to get the message out there that, we're all the same people. We should be all on the same page. Right? And so this is where we should all lift each other up. Mwah! And that's why I'm always here for you guys, unconditionally. So then we have is a spiritual health. And for spiritual health, meditation is great, along with it turns genes on and off. We have spiritual health is, gratitude. So gratitude is so amazing because immediately when you wake up in the mornings, if you say 10 things that you're thankful for, what it does is it just helps you become more coherent. Everything starts to work better. They've done studies where it actually improves chronic illnesses because it lowers inflammatory markers. Putting sticky notes all over the house can all really optimize your health and well-being and subliminally create this zone of positivity that then helps you heal from the inside out. Because studies have shown that if you live in the state of frustration, that can cause problems and disease and, you're all over the place, right? So that causes a lot of problems and can be one of those key factors to your chronic symptoms. So by creating that subliminal zone of positivity that you do immediately when you wake up in the morning, and then you say 10 things that you're thankful for, all of that really, really helps you get on the right track. And, it's like when you wake up on the right side of the bed, very similar to that. The choices that you make throughout the day are a lot better. Yay! So then we've been talking a lot about digestive health, right? Right now, do you see how sad the gut is? Very, very sad. So my goal in life is to make sure, along with everything else, make sure this gut stays happy. And let's talk about that. Let's recap that really quick also. So the difference between somebody with a problem and somebody without a problem, if we study the same anatomy books and we study the same physiology books, if we're all the exact same on the inside, it's our environment that makes a difference. And the biggest connection between our outsides and our insides is through our mouth, right? Yay! So our mouth is direct, that's where obviously the food goes through our digestive system. And there's all these different parts, but the specific one that I want to talk about here is in the gut area, right? And that's specifically like the small intestine, large intestine, specifically the small intestine, because there are these cells, and these cells are tightly packed, and they have tight junctions in between, tightly packed. And so over time, what happens is that, let me just show you this picture here. So do you see how the cells the wrong side, this side here. So we have, I know this is backwards, in my book it's the right way, but what happens, this is the healthy gut. So do you see how there's tight junctions in between this? And so we have, in our gut alone, there's 100 trillion bacteria that line our gut lining. Isn't that crazy? 100 trillion. We're only 10 to 32 trillion human cells. Don't think about it too much. It'll freak you out. Yeah, no, let's move past that now. Because what happens is that, so we have is good bacteria, and the good bacteria should be 70% good to about 30% bad. And these bacteria help with your digestion and metabolism, and they help with, your epigenetics and your immune system and creating these neurotransmitters, because 70 to 90% of your serotonin and 50% of your dopamine lies in is made in the gut. Isn't that crazy? So that's all the job of these bacteria. Now you can say thank you, gut bacteria. Yeah, isn't that awesome? So what happens is that over time, especially with chronic, so that's what happens when everything is balanced. But over time, what happens is that when you have an imbalance, you increase stress or the foods that we're eating, and we discussed all those foods, especially gluten and dairy and sugar and processed franken foods, and there's all these other foods like alcohol and other hydrogenated oils, and all of these foods, chronic stress, medications, infections, all these things can actually start to kill off some of these bad bacteria and get replaced by good. Kill these good bacteria and get replaced by bad bacteria. That then then obviously these bad bacteria don't do the job as well as the good bacteria we're doing. So they let things through that should not be getting through, causes inflammation, causes, the secretion of LPS. So there's a lot of mechanisms. You guys can go back to your to the other Facebook Lives where I talk about this in a little bit more detail. And what happens is that when it starts going through, 70 to 80% of the immune system that's in the gut starts to attack it and says, you should not be here, right? And so when it goes and attacks it, it leaves immune complexes to go all over the body that then if it goes to your brain, it can cause all these neurological symptoms. If it goes to your heart, it can cause atherosclerosis. If it goes to your everywhere, it causes every autoimmune condition. It causes, it can cause your hormonal disruptions like fibroids and endometriosis and problems with irregular periods and cramping and all of the things that can lead to chronic inflammation in your conditions. Then we have is skin disorders like eczema and psoriasis and all of the skin conditions that can lead to digestive complaints. We have your joint and arthritis. We have ear, nose, and throat. We have cancers, respiratory disorders, eye conditions, psychological. All of these conditions can be directly related to a very sad, sad gut. So we want to make sure that your gut is not sad, right? I want to try to make your gut as happy as possible. So how are we going to do that? The best way that we're going to do that is by focusing on extinguishing the fire that's in your gut. Because right now, there's that fire, right? We don't want that fire. You want that fire? I don't want that fire. So no fire. So even though sometimes I can be a little hot. I'm kidding. No. Haha, that was my joke. But so what we want to do is we want to take away that fire. And the best way to do that is to first, diet is the key to healing your gut. There are other pieces and we're going to discuss that, but that is really, really important. And there are so many gut healing diets out there. And so with like the GAPS diet and autoimmune paleo diet and SCD diet, and there's Candida, and there's Dr. Amy Myers has one. There's so many gut healing diets out there. Lots and lots. And they're all amazing. They're all amazing because everybody is different. So then there's so many diets that can help that individual person, right? So yay, kudos to them and kudos to all those diets. But for me, I got confused with all of those diets, right? Especially when I'm telling these patients that, oh, you have all these conditions. So they're like, just tell me where to start, doctor. So all of these autoimmune and these gut healing diets, let's focus on what they have the same and not what they have different. And that then clears the confusion. So if we focus on what they all have the same, is that they all have these pieces of the puzzle, right? And that is, first you need to remove the gasoline. I know this is backwards. It is the right way in my book. Yay! So we have to first remove the gasoline, and that's removing all of those foods that act like, that just keep the fluid ignited, right? Then we want to replace with good foods. And that is, again, what do all the diets have in common? Vegetables, protein, and healthy fats. You only want to put in your body those things that are most nutrient dense, helps keep your gut happy, and your hormone, insulin, glucose balance. So those are those foods that will optimize your gut healing. We're going to add those back in. Then prebiotics and probiotics that we're going to talk about in a little bit more detail in the next few Facebook Lives. We have is your fish oil, vitamin D, broth, and then some gut healing supplements if needed. And then we have is your rebalancing the body, right? We have to make sure that your spiritual health, your social health, your sleep, your detoxification, all of those are really key and important to keeping your body totally in balance. That will then optimize your gut healing. I have seen lots and lots and lots of, this is probably one of the most important pieces also down here. So the removing them, and then these two pieces I feel like are really important. And all of them are, but specifically, you can be eating all the gut healing diets in the world, but if you're stressed and you're not managing your stress appropriately, your gut is not good. Your symptoms are going to still remain. You can again be following all of the gut healing approaches and the best diet, but if you're surrounded with negativity, if you're not sleeping well, if you are internal and externally negative, or just your social friends are not nice to you, any stresses, any of those 4 S's that are off and deficient, or if you have toxins in your environment, if you have infections, all of those specific things can lead to your chronic symptoms. So no matter what kind of diet you're on, if that is not balanced, it's not gonna, so it's all together, and it's works well all together. So when I have people start this, I want to make sure that they have at least about a month that they can really dedicate to this, because all of our lives are really crazy busy, but you are so important. You are the only person that's going to stick with you for the rest of your life, right? So to keep this as healthy and happy as possible is really, really important. And that's where you are worth it. So dedicate yourself, your time, that you are then able to heal your gut. Plan ahead, find that 4-week stretch of time, dedicate that time for you, find different ways, like list your obstacles and try to see what you can do to help to limit those. And like, for example, what I do, I know that my days sometimes get crazy with all the kids. And so I always have something backed up in the fridge, so then I don't have to run out and get something emergency-wise. Because of things that you get outside are not typically on that gut healing approach. So we really want to focus on this, but guess what? We can do this together. I am here for you, love you, we'll do this together. So what are those foods that we need to first remove? And it's not just typically foods, it's chronic stress. We want to remove the chronic stress, but specifically let's talk about foods first. So if we need to remove, we talked about how gluten was so detrimental to your health, and especially if you're a chronic condition. Because your gut is so sensitive already, that there have been studies that show that all the grains can still create the same type of approach, same type of reaction. So what I do is I have people take all of them out. So yes, that includes your barley and brown rice and buckwheat and oats and oatmeal and popcorn. Yes, even corn and quinoa, because technically they're not grains, but they do contain the same amount of proteins that are very similar to grains. So I just take it all out. Take it all out. Just for a short time, right? Because then what happens is that it starts to heal a little bit faster. So the next thing, we talked about the dairy, the alcohol, the starchy vegetables like potatoes and corn, even though that's technically more of a grain, the nutrient-depleted foods, processed foods, genetically modified, hydrogenated oils, all of that needs to go. Sugar, out. In order to heal. And then we need to really, if that's the first main step. But sometimes in some cases we need to consider, we have to remove stress, chronic infections, the people that are negative in your life, remove all the negativity. All of that needs to go in order for you to heal. Taking out one food at a time may be more difficult, but what's really, really important is that we want to really get you feeling better. I've had people get immediately what they do is they just, when they take out one at a time, then what happens is that they don't feel as well, right away. So then they're like, oh, I tried the gluten stuff and it didn't work. Or I tried dairy, and then you get discouraged. But they really feel amazing if you take out one by one, like all of them together, instead of one by one, then you really feel amazing. I've had people where they just take out all of it out once. In like 2 weeks, 99% of their symptoms are gone. I know, it's crazy, and that's why I keep on doing it, and that is why I'm so passionate about this. So you are worth it. I will see you next Facebook Live next week, and if you have any questions, message me here, and I can't wait to interact with you guys. I love you. I'm going to be here for you so we can take every step of the way, because you are a gem. Can you imagine all that you have accomplished being less than 100%? I can't even imagine what you'll be able to accomplish when you are at your 100%. The sky is the limit. And guess what? I am here for you. So let's do this together, you guys. Blessed. Have an amazing weekend, and talk to you next week. Mwah! Bye.